Because most of us have a daily life in which we really rely on our bodies. We got children, we got jobs. Some of us got two jobs, and when your body is shut down in a way that suddenly you can't provide, it can really make some real wake up calls in which those bells are ringing on. What are we gonna do? How are we gonna live? How are we gonna pay rent? How am I gonna work? And I actually, I had to be out of work for 2 months.
Hey everybody, this is Dr. Kevin with Balance and Body Restoration, and today I have with me Blake, who we've been working with since about last year to help him recover from a pretty significant back injury. And he was actually kind enough to allow us to ask him a couple of questions and just share his experience in recovering from his injury. And the reason why I wanted to talk to Blake and kind of go over this case study is because just know that there are a lot of people who are likely to be in a similar situation to Blake, either who have had a back injury or who are dealing with chronic back pain. And I just felt like there's just a lot that we all learned from working with him and being fortunate enough to help him see him recover. And I just hope that this, interview or some of these what Blake's going to share can help those of you out there who might be going through something similar. So thanks again for doing this.
Absolutely.
So I guess we can just start off, if you don't mind, just kind of talking about what happened. I think last year. How did you hurt your back, and just give us an idea of kind of where you're at in like the weeks following the injury.
Absolutely. So we were emptying my mother's house, helping move furniture. We had to, do a lot of big pieces of furniture. My mom liked the kind of classic older wooden armoires and things like that. And so to get those out of the house, my brother and I were doing a lot of team lifting, which I felt like was, the right thing to do. There's one particular piece of furniture that we were trying to get out of her bedroom, and we both did a team lift where we bent down, squatted, picked it up together, and in an instantaneous moment, I immediately felt both just some sort of popping feel as well as a weakness and just an absolute need to drop the piece of furniture. And I actually still struggled a little bit and tried to fight through finishing the move. I knew that I was hurting pretty bad, but I was thinking that this might be a classic, just soreness or hurt
Yeah,
from lifting too much. But I actually woke up the next day with what I would say was like lightning pain, like strikes of electricity going through my back down to my feet, down to my foot, all the way through, and I could not even get out of bed the next day. I was in tears. I
yeah,
was really hurt, and it was much more aggressive that very next morning than I had thought that I would be like. It,
yeah,
it, it was really painful, and it took me about 3 days to be able to actually get out of bed, and quite a few calls to the doctor to make sure that I could get a doctor appointment and be seen right away.
yeah,
And unfortunately, their closest appointment was about 3 weeks out. And I, was really, really nervous and really
yeah,
upset because
yeah,
I couldn't get out of bed.
yeah. No,
Yeah.
no, for sure. And then yeah, how did the next like couple of weeks play out, if you can kind of recall back to just like what day to day was like, and just kind of how you were trying to manage after those first 3 days kind of being bed bound? Like what was it, what
Yeah,
was that like?
I struggled a lot. I didn't know how to be or where to be physically as far as laying down, standing up, or anywhere. I felt an intense amount of pain, the most pain I've ever felt, probably that next 3 weeks following. Within getting myself out of bed, I realized that just walking to the bathroom, just getting out of the bed or getting off of the couch or getting on the couch was so painful that I found myself that I would be on my hands and knees trying to get on the couch. And I didn't know
Yeah,
whether standing up was better or laying down was better
yeah,
because I was so stuck in a point. I couldn't drive if I sat in the car. I was in so much pain. I felt like I was sitting on something that, if I was on it for more than 2 or 3 seconds, it was like lightning pain. I couldn't get out of the car. I'd have to pull myself out of the car. And actually, the most comfort I found in is if I just kind of lightly kept walking, because if I kept standing or kept sitting or kept laying down for too long, I was in total pain and I was completely paralyzed.
Yeah.
If I at least shuffle stepped, and I have a dog that I'm thankful that I'd have to walk, and I would walk her around the block, and I would just shuffle step. And I had a few neighbors come out and they could hear me groaning and they can hear me crying as I'm trying to make these steps,
Yeah.
because it was still painful, but it was the only way that I could get that searing pain
Yeah.
to kind of subside.
Yeah.
Those 3 weeks following were really a struggle. I thought that maybe I permanently paralyzed myself in a way.
Yeah. Yeah. No, and you know, that was a legitimate possibility too. That's why I want to talk to you, because that was like not paralysis, but it was a bad one. It was a pretty
It felt
bad,
very
like,
handicapping. Yeah.
yeah, not I use the term, it was not a Mickey Mouse injury at all. This was a legitimate, like, back injury, back strain that needed to have just all hands on deck. Like, there were just no mistakes that could be made if we were, gonna like be able to get someone like you through that. So that's, thanks for sharing that. So when did was this, like, obviously the excruciating pain, but when was like the oh crap feeling, like, oh my gosh, like, this is, I have to go get some care for this thing, like, now? Was it pretty much that at that point,
It
or
was
is it
pretty
like, I
much
think
at
after
that
like that
point.
vacation I think you took?
Well,
um
really, it was, I still, I'm a father, and I try to take on a couple mornings a week to take my kids to school.
yeah.
So to drive them, 5 or 10 minutes to school, while my kids are in the car, and I was kind of like having to scream through it. I was kind of having to shut. It was almost like I wasn't even sure if I was going to make it from my house to the school just to drop them
Yeah.
off. And this is just such a simple car ride,
Yes, 5-minute drive you've
five
done
minute
a million
drive,
times.
and my kids were saying like, what's happening, Dad? Are you okay? Like, what's going on? And
Yeah.
I'm just, I couldn't even talk. I just had to find a way to like kind of hum my way through it.
Yeah.
So the fact that I couldn't do anything day to day um, was a complete shock to me,
Yeah.
and made that realization that this is really bad.
Yeah.
Yeah,
Yeah. And then you got in to see the doctor finally
I
after,
did.
weeks or
A couple weeks,
whatever.
I finally got to see a doctor. I actually didn't get to see my own personal doctor, because that appointment was even longer. So this was more like if someone could fill in, because I finally, phone call after phone call, I really had to drive the fact that I could not wait for whatever deadline, that date farther out that they gave me.
Yeah. Yeah. Yeah.
And so this person gave me steroid anti-inflammatory pills, as well as uh, some muscle relaxers, and basically it was a let's see how this plays out over the next 3 weeks as you take this medication
Yeah.
and see what happens.
Yeah.
That's what I got.
Yeah, that's actually pretty reasonable, I'd say. Obviously, in a case like that, where the pain is very extreme, where there's been a major injury, steroids, anti-inflammatories are very useful to help at least bring the noise and bring things down to a point where you can actually start to recover. But then, what happened, like, after that? I remember we were kind of talking before about how you they kind of give you these medications and said, that's, you didn't really know what to do at that point, to
Yeah,
take back.
number one, I didn't like the way that the steroid anti-inflammatories made me feel, despite the fact that I knew that I needed to keep taking them.
Yeah.
I definitely was getting, of course, the pain and everything is going to make you moody and
Yeah.
make you upset, but I definitely was feeling the effects. I think I was becoming moodier. I was becoming kind of angry. I could feel my face swelling. I could
Yeah.
kind of even see in the mirror a
Some
different look
roid
of
rage.
me.
Yeah.
And the hard part was that I felt like it was affecting my family. I told you that we took a planned vacation actually the very first of May. So this is 4 weeks after the injury, and we had planned a whole year to take our kids to Puerto Vallarta. And it's not, it's like we did all this process to
Yeah.
get the passports. It's like we're not going to stop
Yeah.
now. So we make that move, but I was still on the last week of the regimen of the steroid
Yeah.
anti-inflammatory and these muscle relaxers, and I felt like, okay, well then if I go to Mexico and if I'm really calm and I'm going to continue to take this medication, this will probably be really good for me,
Yeah.
right? Well, that vacation was not fun because I was not myself.
Yeah.
And so as a result, I felt like, I actually am feeling moderately good. I'm
Yeah. Yeah.
feeling a
Yeah.
little bit better. And maybe I don't need to take these steroid anti-inflammatories because I just see the negative impact, and I'm feeling pretty good. So I remember it being a Wednesday, smack in the middle of our week-long vacation, that I decided I'm not going to take these pills. So, in fact, I think that if I just have myself a cocktail and have a muscle relaxer and just kind of try to chill out and try to
Yeah.
lay on the beach chair, this will be fine. And that's when the rude awakening happened. The next morning, it was like the very first day I got hurt. I couldn't get out of the hotel bed. I was back in tears. I had the searing knife, lightning pain that, and I'm, not just my back, but it was the entire row, and it was nearly worse pain than what it was 3 weeks before, to the point where now I'm stuck in the hotel room and I'm crying, and the next day I just realized that I guess I do need to continue to take these
Yeah. Yeah.
these steroid pills.
Yeah.
So I jumped back on them, and was able to kind of come back home, but of course that prescription was about to run out,
Yeah.
and I also expressed to my doctor that the muscle relaxers were running out and that I needed more. And I actually got a questionable response, like, you weren't supposed to take this many muscle relaxers, and you shouldn't have to refill so fast, and what's going on. And it made me feel like, there was a little bit of a questioning of like my integrity. Like, am I just trying to pop these pills and
Yeah.
ask for more? And I had to express that. And no, it's really
Yeah.
this bad
Yeah.
that I can't take one, I got to take two.
Yeah.
And that's when the doctor actually gave me a referral to the back
Yep.
specialist of the hospital.
Yep. And
And
how long was that out? I remember.
that was another 2 to 3 weeks out. So
Yeah.
that was, by the third week of May, I finally saw, a back specialist.
Yep. And then if
Right.
you can remember how that played out.
She said that it was good that I saw a positive response from the steroid anti-inflammatory. She said that this means that, while it's not a large response, as in like you're not better,
Yeah. Yeah.
however, during that moment in time you've been taking it, you felt like you were feeling relief so good enough that I thought that that day I could get off
Yeah.
them.
Yeah.
But clearly I was wrong.
Yeah.
But she said that that's a hint to the fact that the inflammation that's going on in your back is responding to some sort of steroid
Yeah.
type. So she said we're going to go ahead and move forward and have a epidural assigned to you
Yeah.
in the back, near the spot,
Yeah.
so that can have a general, more larger impact,
Yeah.
hopefully,
Right.
on your injury.
Yeah.
And I felt like in that moment, at least I had some traction of somebody that was trying to really make a genuine step to, acknowledge what was happening to me, and that, here's a step we could make
Yeah. Yeah.
to make things better.
Yeah.
The only problem was then, you go to, I got an MRI. She assigned me an MRI and the epidural.
Yeah.
The problem was is that while the MRI was, at the beginning of June, the epidural wasn't scheduled until like all the way out until the end of June.
Yeah.
Um, and so I believe it was that first session that I met you that I brought the paperwork that
Yeah.
explained everything in the MRI, and it explained the disc bulge to you,
Yeah.
and you were able to read that out to me.
Yeah. And what Blake essentially had was as close to as bad of a disc herniation that is on the verge of requiring surgery. It was called a disc extrusion of about 10 millimeters, which is it's a pretty big one. And these things are very borderline, cases in terms of whether or not a person needs surgery or not. And a lot just kind of hinged on these next couple of weeks of whether or not we could actually get his pain under control, and that if we were actually able to start to see some improvement, then we felt that we could help him heal without it. But if his pain and symptoms were just kind of how they were, then those are usually the cases in which that no one wants to have back surgery, but that it's definitely a better alternative than living with those the type of symptoms that he had. So getting these decisions right now is so important. In that, so if you are someone out there who has symptoms like this, or if you have really bad symptoms, and if your doctors aren't giving you an MRI, if they're not, giving the proper imaging, or if they're just kind of treating you like someone that's just kind of, craving for pills, then it's important that, you really need to learn how to advocate for yourself and really help the doctors know how bad your symptoms are. Because if you're just not letting them know, then they might not go the extra mile for you. So again, this is just an example of just really advocating for yourself and just making sure that you, um, just make sure you get what you need done. So thanks for sharing all that. So for Blake, we were it was a really good sign that once we had him get in for an injection, um, we actually tried to push him to get an injection sooner than what he was originally planned to, just because we could
Yes.
just sense how compromised and how limited he was in terms of his pain and his motion, and that we have felt pretty confident that since he had responded well to steroids in the past, that a more harder steroid should help at least calm things down, not heal it, not fix it, but at least get him to a point where he could start to recover. That's kind of what happened.
So
So
we did a. It took me maybe about 10 phone calls, and not trying to berate the nurse or get mad at them or anything like that. But at the same time, I really had to like continue to explain that I felt like I couldn't live the next day if they were going to continue to push out this. So someone actually called me and said, you know what, we just had a cancellation. We've got a window here where we can get you in, in the next 3 days. And would you like to take that? And it was actually, just after we had our conversation about why, possibly this epidural could be really
yeah,
helpful. And so I did take that and I did get that epidural into my back. And the following week when I came to visit you, I think we already saw, a little bit of a difference in the way that I was walking into the room here,
yeah,
in which you felt more comfortable that you could give me some treatment
yeah,
because I could actually sit or bend my
yeah.
body, whereas before I couldn't
Can
do
do anything.
anything without feeling like I was going to fall apart into tears. It was
Yeah,
so painful.
yeah, yeah.
Yeah.
Yeah. So, yeah, thanks again. Thanks for sharing all this. It's tough. I can't imagine just revisiting all this stuff, and just all these things going through your mind. So, it's thanks for just opening up and sharing all that. Um, so, what was kind of going through your mind like that first like month or so after the injection when things were starting to get better? Because I know that a lot of people don't automatically think to go see a PT or go to someone like us for as the first line of action to kind of deal with these things, and that your father is the one that kind of referred you to us. That's how you knew. But what were your like your preconceived like notions about like what we were going to do, or what were your ideas of what you thought would happen? I'm just curious to know kind of what was going on through your
Honestly,
mind.
I didn't know what to think, but I had a day where a friend of mine picked me up, and he just kind of wanted to take me out for a slice of pizza and a beer, and just kind of be my friend, which I really appreciate that. Um, but we also had a lot of conversation about his own spouse's experience with a disc bulge and how surgery was actually the best option, and he recommended that I go through surgery. And the biggest thing that was kind of the topic of our conversation, which it made me chuckle a little bit, but he honestly said to me, and it made me think. And he said, he saw how about a shape I was, and I looked like a different person. I was really, everybody was like, wow, look at you, you're
Yeah,
a totally different person. This is awful. And he said, you really think you're going to work out your way out of this? And
yeah,
in a way, to me, that was kind of like yeah, you're right. That sounds
yeah,
really stupid. It
yeah,
really does. Like for a
yeah.
moment there, he didn't kind of talk some sense into me, like,
Just get it done. Like, what are you
yeah,
doing?
just
Yeah,
just go get the surgery because my wife had the same thing, and she needed to get the surgery, and we know somebody, and we can
yeah,
call that person. We'll get you in. And I said, I've gotten this referral to the physical therapist, and he just said, look at where you are, buddy.
yeah,
You can't even walk into the pizza store.
yeah,
You can't even sit on a stool. You have to stand at the bar and eat pizza like you're trembling.
yeah,
And he said, you're really going to work out your way out of this situation.
yeah,
And I did kind of feel a little stupid, like I
yeah,
was saying, like, yeah, I'm going to try to give this physical therapy a try. I'm going to try to avoid back surgery. And I felt like, maybe I'm not making the right call.
yeah,
Maybe I should consider surgery. And especially when, as honest as you were with me, which I appreciate, where you said, it's not guaranteed that I'm going to be able to get this done through physical therapy, and you're going to give me a strong effort. But
Yeah.
that warning, made me really nervous, and I actually I did not think that I would be
Yeah.
at this point today.
Yeah. No,
Last year,
honestly, yeah.
I really didn't think so.
Yeah, so for anyone that's watching, like there are degrees of different types of disc bulge and disc herniations. There are some things that are complete nothing burgers, and people are scared to death, but it's literally nothing. It's I probably have like a small disc bulge sitting here right now, but I have no issues whatsoever. But on the opposite end of the spectrum are the real structural like disc herniations that's creating a massive amount of compression on your nerves and your back and your spinal cords, and can be medical emergencies. And I always felt like Blake's case was just on the cusp, just on the borderline that we obviously want to avoid surgery at all costs because of long-term consequences, especially if things don't go well. But at the same time, the people that need surgery, and we don't want to wait. We don't want to waste any time. But luckily for Blake, things actually turned out for the best. So I don't want to get into the details in terms of exactly what we did, but long story short, we actually were able to make some progress within a couple of months, and his pain was reducing, his mobility started to get better. But what would you say was like the big like turning point that kind of felt that you gave you the confidence that you were going to kind of get through this, if you can recall?
For completing the first month, and trusting you, in which you told me that, while I got this epidural injection, and you really warned me that, I'm going to feel a lot better, but that I'm not, and you told me that, we're really going to have to continue to stay cautious for this next month. And first of all, I really felt cared about, in which, it gives you a little more sense of confidence, so that maybe you could see the light at the end of the tunnel. But it was, by the time we made it to August, we went through June, we went through July, and it was a lot of cautionary stuff, where
Yeah,
you were really just kind of trying to
told you to
help
do,
me
you got to
relax,
do
but you telling me
nothing.
to do nothing. And obviously, my wife wasn't happy with that. My children weren't happy with
Yeah,
that. But I tried to really heed to that. And it was when we set some goals down, where you put a weight on the ground, and it was extremely light. It's a 10-pound weight, and we
lifting off like an
actually,
8 pound or eight inch like
yes, I mean,
lift,
it's
and just
nothing. And
yeah.
you gave me some blocks for it to start off, so it's not even coming off the floor. It's coming off,
Yeah,
12 inches. So I'm barely bending over
yeah,
to pick that thing up. But just to get just the slightest body movement, um, it felt a relief on that. I can build from here, versus I'm never going to be able to get off of this point.
yeah,
For the prior 3 months, I thought I might need to get a handicap placard. I might
yeah,
I might never be the same.
yeah,
I might never be able to wrestle um, with my kids on the floor,
yeah,
or play baseball with them. Um, and that was,
yeah,
August, to be able to just pick up a 8 pounds, slowly, and
yeah,
methodically, and smart. But it just gave me that sense of confidence of, we're going to go the long route. We're going to go physical therapy, and we're not going to get surgery. But I'm going to kind of build.
yeah,
Um, and that's when I started to feel like, I can do this.
yeah.
Yeah, August was a big breakthrough, I think, for me.
Yeah, no, I remember. Yeah, it took a while to get to that point. And obviously, we're not just throwing stuff at him, and he had been doing a lot of very gentle stretches, gentle core exercises along the way. Most important thing that we try to help people understand is that you have to move, you have to do things that to the best of your ability, as long as you're not pushing through pain, not pushing through symptoms, and again, just being very methodical about what is safe and what is not. And there's a lot of too much information out there in terms of what exercise to do, what not to do. So that's why really trying to find someone that honestly knows what they're doing, and making sure that as you are doing things, make sure that you feel good about them, is the most important thing that you can do at any point in your recovery. So Blake was doing a lot of walking, because walking wasn't hurting him too much, but he was avoiding lifting, avoiding bending, avoiding long drives, or to the best of his ability.
The sitting we
Yeah,
talked about, I think I had to learn more about what was really these triggers that I wasn't aware of beforehand. And once we really started to identify some of
Yeah.
those triggers, like the sitting, and realizing that I found a safe space in walking, you encouraged me to continue to try to stay in that safe space. So,
Yeah.
before coming to therapy, I tried to take a nice long walk. After therapy, it was like I took another long walk through town,
Yeah.
so I didn't go directly into the car, and I just tried to really let my muscles feel comfortable, without trying to put it in those moments where, I'm starting to get that pain to
Yeah.
arise again, and just kind of being, um, you know mentally aware of it, of what I was doing.
Yeah. Sure. Yeah. No, appreciate that. Okay, so I guess next question would be, what were the main things that you learned from this process that you just had no idea, kind of, prior to this, that you almost wish that you had known, before all this had happened?
Um, I wish that I knew that I was lifting, heavy items incorrectly for a long time. I am in the wine industry, so lifting cases of wine for me is a daily thing, and being physical is a daily thing. Being active for me is a daily thing. And so I've always felt confident. I always felt strong, and I never thought that I would ever be in a situation like this, because I always felt like I was doing a good job taking care of my body, bending my legs, using my legs. Um, and I wish that I knew to kind of feel these light symptoms and identify them earlier, because the more that we talked through our physical therapy sessions, and the more we started to you started to ask questions about a couple of the years prior,
Yeah.
and we learned that, in fact, while the large armoire that I picked up with my brother was a breaking point,
Yeah.
I clearly had been doing a lot of bad things to my back that I was not aware of, or putting in, compartmentalizing that, I was going down to a road to eventually a straw is going to break the camel's back.
Yeah.
I really felt strong.
It's
I
the literal analogy of the straw that breaks the camel's back is how most back injuries happen. They usually don't happen all at once. In this case, it did, but there were things that preceded it to have happened, and that's the thing that I wish that more people would know about, and to be, if your body doesn't feel right, if you feel stiff, you feel a little bit of kind of pain after you do just your normal activities, that is not a normal thing. That is not something to be pushed through. That is not something that you should just keep, ignoring as just a part of aging or just a part of your everyday life,
I thought I was
right?
just kind of getting a little fat. I just thought that, man, I get a lot of shape, and I didn't really realize the extent of sciatica and the sciatic pain and the sciatic nerve pain, and I didn't attribute that I was actually feeling these sciatic nerve symptoms, you know, 3 or 4 years prior to this injury.
Yeah.
But I was attributing it to, like, maybe get a little heavy, maybe I need to go for a run more, maybe I need
Yeah.
to stretch more.
Yeah.
But as we talked about, you
Yeah.
know, this was some preconceived stuff that I should have been more aware of, I
Yeah.
think.
There are stories that we tell ourselves when we feel certain things that are not rounded in any form of scientific truth. It's just these little stories that we just think are, that we tell ourselves to explain our condition, that again are usually warning signs medically that need to be taken care of, but most people just don't even know. So, you know, what's happened to Blake has happened to a lot of other people. So we just try to advocate for people that if your body doesn't feel right, if there's something off, get that thing assessed, get it addressed. Do not wait for something like this to happen before you have to do these types of things. Is the main point why we want to ask that question. So, but how do you feel now about a year now after the initial injury? Where you're at? I know we're not 100%, but where you're at compared to a year ago.
I feel I feel great. I'm thankful, but at the same time, I know I still, I'm not there fully. I'm not 100%, but I'm so much stronger mentally, I think, where I want to make sure that I'm protecting my back, but I'm also um, making sure that I'm being active, and I'm engaging myself in purposeful routine in which I'm strengthening myself, and I'm not just holding back now. I'm really trying to rebuild, and Kevin, your techniques have made it so that it's been more step by step instead of just I'm working out again. It
Yeah.
was absolutely not that way. These were really tiny little
Yeah.
steps. However, now at this point, with some workouts that we just did, to be able to feel the strength in my lower back, to be able to feel right now in my glutes and my hamstrings, and just a little bit of that. It feels like I got a good workout
Yeah.
in, and I feel stronger. And I know that there were some workouts that I weren't including before when I used to
Yeah.
work out, and I didn't realize how much that core factor was so important.
Yeah. Yeah. Yeah.
And now that I'm engaging my core more, now that I'm using my back properly, I'm getting more out of my
Yeah.
workouts than I did before.
Yeah.
And in a way, as much as I wish that I had never experienced this, um, it's a major blessing,
Yeah. No.
right?
Yeah. No. Thanks for showing. Sorry, I have this light that goes on and off if we don't move. But yeah, no. Thanks again for sharing all that. And then just one last question. Is there anything you'd like to say to someone who might be going through a similar situation? Again, this is who this video is for. Stuff is serious, and we try to have fun. We try to, but we try to take things seriously, and we just want to help others that are out there. So, what would you say to someone who might be in a similar situation?
Um, well,
You know,
apparently you're not alone, right?
yeah,
You're really not. And I felt alone. I really felt alone. I really felt like, my doctor wasn't responding. I was getting bounced around to substitute doctors, and I wasn't getting follow-up calls.
yeah,
If I did need to make a phone call or a video call, I had to pay another co-payment again. And it just felt like the whole system just felt ingenuine. It just felt like, here's your prescription. And, if I wanted any follow up care, it was on me to get that follow up care. And, to come into this room and to work out with Kevin, it felt like, I finally got an advocate, and it's possible. So, take it from me and the genuine in my heart that not only am I thankful, but, I hope it inspires you, because most of us have a daily life in which we really rely on our bodies. We got children, we got jobs, some of us got two jobs. And when your body is shut down in a way that suddenly you can't provide, it can really make some real wake up calls in which, those bells are ringing on, what are we going to do? How are we going to live? How are we going to pay rent? How am I going to work? And I actually, I had to be out of work for 2 months, and I'm still actually working my way back through that.
yeah,
I'm working two jobs right now,
yeah,
as Kevin knows.
yeah. No, and
However, I'm doing it.
yeah,
I'm doing it. And when you say that you're thankful that your body works, you don't take that for granted now. And I'm gonna build it. I'm gonna keep working out, and most importantly, I'm gonna keep going to work, and I'm gonna keep paying bills. I'm gonna keep providing, and it feels good. If it's
yeah,
a different feeling now, it's like, I'm happy to go to work, and if I got to work a second shift, I got to remind myself that my body is capable now to do so, and that I'm gonna put that effort in.
yeah.
You know,
No,
it's
for
a
sure.
it's a daily operation in which we all take so for granted until all of a sudden you just cannot physically operate. And I had no idea that I would be at that point.
Yeah,
And to sit here today with you in a conversation,
yeah.
and
Talk
to
about what
talk
good
about
happened. Yeah,
it,
and looking
it's
back on it's all now, and
it's
it's
a
like,
real blessing, man.
yeah.
It's incredible, but it wasn't easy, right? Like it
No,
didn't
it was
come.
not easy, and every before you come in, like I'd be nervous. We're nervous about these types of cases because how serious and how severe they can get, and the responsibility that we're under to help him get back to doing the things that we know that he needs to do. So there's an enormous amount of pressure on us to get him better and make sure that we're doing the right things, and that we're not you know doing things that are done without extreme amount of care and caution, but that it's possible, guys. It really is possible if you just take your time and just take things step by step and make sure that you're finding people that know how the body works and aren't trying to sell you on just like pills or magic devices or things that will just cure this thing overnight. These things are very serious, but you have to take them very serious. But if you do that, if you do things, take things very slowly, very cautiously, very strategically, listen to your body and just know what's right. It's possible, guys. It really is. And that's why I want to talk to him, because of just how fortunate we were to see this thing through, and it worked out. And thanks again. It's and thanks for doing this. I appreciate it, dude.
Absolutely. I'm happy to be here, and I hope I can continue to put the hard work in, and know that I'm actually, I think I'm going to be better next year than I was at this point this
Hell yeah,
year.
that's what we want
And
to hear.
I'm excited to attack. I'm excited to put my effort in, and I'm just so thankful that I can. And Kevin, I'm just so thankful I
Yeah,
walked through that door, man.
yeah, dude. Yeah, thanks to your dad too. All right, man. Thanks again. All right, everybody. This is our first little like podcast interview case series, and we'll hope to do more. So stay tuned. Thanks again for watching.
Thank you.